What PTSD symptoms are often overlooked in diagnosis? Imagine feeling like you're living with a constant weight on your shoulders, but your doctor only looks for the usual signs. Post-traumatic stress disorder can be tricky to spot because some symptoms hide beneath the surface or don't fit the classic picture. While the main criteria include intrusive memories, avoidance, negative thoughts, and hyperarousal, many important signs are often missed. For example, some people experience subtle trauma responses that don't involve the typical events like combat or assault. Individuals with autism, for instance, may face trauma from bullying, sensory overload, or emotional neglect, which aren't always recognized as traumatic in traditional diagnostic criteria. This can lead to their PTSD being overlooked or mistaken for autism traits. Dissociative symptoms are another often missed sign. Feelings of derealization, where life feels unreal or like being in a dream, can be subtle and easily mistaken for other mental health issues. These symptoms reflected a disconnection from reality or oneself and are part of the negative changes in mood and cognition but are not always explicitly asked about or noticed. Similarly, changes in thinking and mood, like persistent negative beliefs about oneself or the world, feelings of guilt or shame, or memory gaps related to trauma, can be mistaken for depression or anxiety. If a thorough trauma history isn't taken, these symptoms might not be linked back to PTSD. Avoidance behaviors are also sometimes subtle. Patients might suppress thoughts or feelings internally rather than avoiding places or people outwardly. Because internal avoidance can be less obvious, clinicians might miss it, especially if they focus only on overt actions. Hyperarousal symptoms like irritability, hypervigilance, or sleep problems are often attributed to general anxiety or sleep disorders, especially if the trauma history isn't clear. Without knowing about a traumatic event, these signs might not be connected to PTSD. Special populations such as children, older adults, or those with neurodevelopmental disorders can show different signs. Children might reenact trauma through play or show behavioral changes instead of verbalizing distress. These presentations can be overlooked if clinicians relying solely on adult symptom criteria. Additionally, PTSD can be hidden by other mental health issues like depression or substance use disorders. When these are the focus, the underlying trauma might be missed if trauma history isn't carefully explored. In summary, overlooked PTSD symptoms include dissociative experiences like feeling detached from reality, subtle internal avoidance, negative beliefs, and trauma responses that don't fit the traditional mold. Recognizing these signs requires a comprehensive assessment that considers diverse trauma experiences and how symptoms can present differently across individuals. Always remember, if you or someone you know shows signs of trauma, consulting a mental health professional is essential for accurate diagnosis and appropriate support.